My name is Embreen Sayani, and I'm a scientist at Women's College Hospital and an assistant professor at the University of Toronto. I lead a lab called the Improving Cancer Care Equity Lab, and the focus of our work is to improve the way in which people access care so that they have the right treatment at the right time in a way that meets their needs and priorities. Our real aim was to listen and learn and understand what works well in virtual cancer care, what isn't working so well, and what needs to change. We essentially wanted to immerse ourselves in the everyday experience of receiving and delivering virtual cancer care. For this research, essentially, we focused our work off two frameworks. One was a person-centered care framework, and essentially what that's about is we need to create care or understand what are patients' priorities when they're accessing care. How can we make it more inclusive and responsive to their needs, but create a relationship of respect so that patients feel valued, but also the providers when providing that care. And the second framework was something called the synergies of oppression. And the way that is constructed is the idea that who you are, where you live, the resources that you have access to ultimately determine your experiences of care, but not in an additive way. It's actually synergistic. So they can determine to much detriment the ways in which people are receiving care. So if we can speak to people who are experiencing the most exclusion or experiencing the most inequities, and then create person-centered cancer care from that lens, we're essentially creating inclusive care for all. For myself, I think these virtual care resources embody for us as healthcare providers what it means to listen and learn from the patient, listening and learning from patients about what their priorities are, what would person-centered care look like from their perspective, and then having tools and resources available to upskill or to learn from so that I can provide better care or so that other providers can do better care. I hear very often from patients who I work with that the best ways in which they like to receive information is through short videos or through checklists, and this resource hub does just that. It addresses key issues that were identified by patients and provides resources and tools in the formats that patients have identified as their priority to receive that information. I think for healthcare providers, these resources are super helpful because healthcare providers do want to provide a good care experience. These videos and formats are easily accessible and respond to care gaps that they felt they needed to fill in order to have a good virtual care experience for the patient. If you're starting your virtual cancer care journey, it's a good idea to understand what tools and resources are available to you so that you can have a good care experience.